Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Hrkal, Melinda Cranin-Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
Hi.
Hello, good morning.
Just a little precursor. I'm having a nervous system shaking response right now. My symptoms are kind of high, but I really want to talk to you, so you might hear that in me. I'm on day 4 after a concussion. I've been working with you for 2 years. I had a severe concussion in March of 2023, and I've been working the program diligently for 2 years. So you've been integral to my life and my recovery, so thank you. I really got to, I lost all function in my life, other than parenting my kids, really. But I got to a functional place. I'm really on the vestibular visual. I've got my syntonics light therapy I was doing, worked with Melinda's work. It worked, I'm doing it. So on Sunday I fell. Let me get to my question. I watched Dr. Marshall's video on what if you've been concussed. My boyfriend and I were like, cool, let's do this. We just went down the list. Got the CT scan. I saw my providers. I got a team here, right? So I guess my questions, and good news I know is it's not cumulative. So, and because of the 2 years of work I've done, I'm not losing my cognition. I feel very cognitively present. What I'm noticing is this shaky autonomic nervous system. It might just be still the shock of the fall coming out. My questions were that I'm trying to assess here at day 4, or maybe I'm day 5. It was Sunday, right? So I'm trying to assess kind of what's my baseline, where am I? I'm noticing that I seem good, I'm good, I can talk to you, I'm cognitively functioning, I'm good, I got my 25 minutes, I'm cool. And then bam, my symptoms spike to a 12 out of 10. And I'm like, my head is heavy and I'm shaking. So I wanted to talk to you a little bit about that. As far as with my assessment, I'm noticing I seem really good. And then bam. And also, Dr. Hrkal, I wanted to talk to you about waking up sucks. I've worked so hard on my sleep hygiene. I've never got my HRV up too high, but waking up from sleep to conscious beta is really painful, really symptomatic. So I wanted to talk to you about that. And kind of give me, where do I start right now, guys? Because I feel like now that I have all this information, I'm like, shit, where do I start now?
I think, Melinda, this is a great place for you to start.
Sure, absolutely. Well, it sounds like this just happened, right? So I love that you're already on it, right? You're here, you're asking us questions, you're trying to create a plan for yourself. And that's all great, but it could still be a little bit early. It might just be this sense of, okay, let me take a breath, right? Sometimes if we get a second concussion, you said it's been 2 years since your first one, you did really well and you had recovered pretty well, would you say? How would you say things were before this occurrence on Sunday?
Really good. I'm still cleaning up my vision. I was
Okay.
working with visual therapy and neck rehab. I'm kind of at the end. I feel like I was fully functioning cognitively and doing really well, actually. So
Yeah.
that's, I think, why I'm so upset.
Absolutely, right? It's a real shock to your system having another injury, especially when you've worked so hard for 2 years to sort of get back to this place of functioning. And you might just be having that nervous system response, right? That sense of anxiety coming up to say, oh my gosh, is this going to create a setback? So, part of it, of course, not all of it, and I know Dr. Cam and Dr. Paul will have lots to say too, but part of it is that sense of quelling the anxiety around, oh no, this is a setback, right? We can get into this catastrophic thinking of, everything's going to go back to the way it was. Am I going to lose my progress? You might notice running thoughts like that. If I'm not mistaken, those can be pretty common, or something similar. And so it might just be, how can I take care of myself right now? Just to support this acute phase post, another hit to the head or a fall. Um, I would give yourself at least 2 weeks of just, doing the basics, which I'll leave Dr. Cam to talk to you about. Walking might be one of the suggestions, and just staying moving without kind of retreating completely. But from a mental health perspective, giving yourself a break, right? Letting yourself off the hook. Give yourself at least a couple weeks just to heal and do the bare minimum to sort of support the progress you've already made, but also take care of yourself following an injury, a new injury. So I wouldn't worry too much about everything's going to unravel and I'm going to go back and lose my progress at this moment, right? Let's talk about that in 2 months' time if you're still struggling. But 4 days out, it might be more of the sense of, how can I best take care of myself to support the anxiety and nervous system response that's happening? Maybe that's slow walks, deep breaths, just enjoying time with your family the best you can. I mean, I'm not 100% sure what symptoms you're experiencing right now. It sounds like they can come on really, really strongly. So it may be that sense of, am I moving too fast for where I'm at? Can I give myself a couple weeks of coasting and doing, some bare minimum recommendations that, maybe I'll turn it over to Dr. Cam to provide that to you with now.
Yeah, I kind of agree with what you're saying, is that, we always talk about these types of setbacks, right? And really what it is our response to it that determines how long it's going to last and how bad it's going to be. So if you are in this particular situation, everything was going well, you get another concussion, and you start to kind of panic about it, that's what's going to keep pulling you down and down and down, right? Like the example I use in the past has been the stock market, right? Like generally the stock market is up and to the right, but every once in a while we have these little crashes that happen, right? And sometimes they're just a 10% crash, but sometimes they end up in like a 30-40% crash. And the difference is when people start to panic and they all start to sell, and then it goes down further. So it's like, hey, you may be dealing with a 10% crash right now, but your response to that crash, whether you're going to panic sell or you're going to just be like, okay, I'm just going to let myself stabilize and then I can start building up again. Right. So if we have that resistance and we're no, 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 I work so hard and oh my God. And now you're that resistance, it's what's going to keep things dropping, dropping, dropping. And then it takes longer to kind of dig yourself out of that. So like Melinda said, if you can just kind of take some time to chill, let all that stuff stabilize, and then you can reevaluate where you're at. In the meantime, yes, go outside, get some, decent, just light exercise, just go on walks regularly, double down on things like the diet, work on, breathing and diaphragmatic activation, because it sounds like you're kind of going into fight or flight. And if you can do things to just calm the nervous system, try to like suppress that kind of shaking response and just breathe through it, and just, you'll find that kind of stabilization point. And then from there, you can start building, right? So don't try to be building now because you're just not there yet. You have to kind of let things calm down first, and then you can build on top. And if you're trying to kind of optimize everything right now, it's probably just going to create more stress on your system to pull you down. So I would say
That's
just
the irony of it, right?
exactly.
That's that irony of it
It's
is you
quicksand,
want
right?
to do.
It's quicksand, right? The more
Yeah.
you struggle, the more you sink.
Yeah.
So you just
100%.
need to kind of chill and let things stabilize, and then you can reevaluate and say, okay, here's where I'm at. But in the
Yeah.
meantime, little things you can do, it's really just calming that nervous system, right? It's have a nap if you need to, go on a walk, make sure you're, just eating really clean, nothing, like avoiding the refined sugars and the carbohydrates and all that. And then working on just like light breathing exercises. And if you can, get some mindfulness in, you might be a little bit too dysregulated for that at this point. I'm not sure. But really just trying to kind of embrace and not resist and not, clamor to get yourself out of the quicksand right now, because it's just going to make things worse. So just try to just and
I appreciate that. So I'm already regulated since the call. So what I'm noticing is my regulation time is much shorter. So I think when I started talking, I was in the symptom spike, and they come on really quick because when I jumped on the call, zero. Like then while I was talking, high, and now I'm regulated again. Just listening to you breathing. I do breath work every day. I meditate every day, twice a day. Like I'm in my program. So I guess, yes, my mantra is calm the F down, right, from your video. My boyfriend loved that. Calm the F down. This is okay. And I have that mental processing to be able to see that and feel that. I think what's happening is what you're describing is that fight or flight is part of the symptom picture right now.
Mhm.
So kind of everything goes with it. My thinking,
Right.
my shaking, right? That is part of the symptom picture. So, um, I guess what I'm hearing, since I understand cognitively, my body, it's like a limbic system autonomic fire that's happening. So because of that, is kind of like the main driver symptom. And then it goes physiological. I've cleaned up my food, Dr. Hrkal, immediately, boom, because I got a little lazy, I'll have to say. It's cleaned up. So Dr. Melinda, do you think going into the mindset work right now and kind of dialing that up, because that seems to be where this is triggering?
Yeah, you might just normalize that nervous system response following an injury, right? It's
Yeah.
natural to go into that fight or flight because the
Okay.
purpose of it is to try to protect you. But the irony of it, or the paradox of concussion a lot of the times, is that the more we listen to that response, the less likely we are to keep moving and doing the things that can help us recover. So validating that fight or flight response coming up, or that limbic alarm bell that's showing up for you when you get symptoms, and just reminding yourself to take it slow and easy, right? Movement, gentle moves, even walking. Like walking is so wonderful just to regulate our nervous system. Get outside, just breathe while you walk, feel your feet against the ground. Even if it doesn't feel like you can maybe meditate right now, it sounds like you're still doing that, which is great, if it's working for you. But some people, commonly people will say to me, I can't meditate following a re-injury just because everything's so heightened. That's okay. Start slow, move, breathe, focus on sleep, rest, continuing to include some joyful activities. These are just the basics to sort of help remind your system that you're safe, right? You had a bump in the road, but it doesn't mean that that alarm bell has to be sounding all day long. It's just constantly sending those signals to your brain, to your mind and your body, that that was a temporary thing that happened and that it's not going to happen again, right? That you're going to be able to regulate again. So taking it slow and easy, not feeling the pressure to kind of get on all the things that are going to make you better, at least not now, right? Let's have that conversation in a month.
Right. I think that's where, when I saw 2 to 5 days, start assessing, get on the train, right? Like, all right, let's do it. I'm not wasting any time here. I'm building a life again. Like, I don't want to, right? So I think that's my main takeaway right now is like, okay, even though it says 2 to 5 days, get on the train, reassess, really like, okay, maybe my nervous system just needs a little more baseline.
Yeah.
Slow it down this first week, maybe even next week. Clear the calendar,
Mhm.
chill,
nothing
do the
wrong with
basics, let
that.
myself come out of the fight or flight, because clearly I was shocked. And then all of what I've learned is just going to drop into place again. And I do want to, I think I can just stay in touch. I'm in the group, right? I'm in your program. I'll just stay in touch. As more
Mhm.
specifics come up, I can ask them then. And just right now, like, just remind myself, okay, maybe day 2 to 5 for me needs to be more like a little, like, just stretch that out a little bit.
Mhm.
Um,
Absolutely.
Yeah. So I have two things to say. One, it was interesting kind of how you said like when I came on the call, 0, but right when I was speaking, shot way up. And then now
yeah,
listening to you guys, it calms down. Right. So that just seems like that's an anxiety or stress response. Now it's, oh my God, it's my turn to talk. And I'm overwhelmed. I have a lot of things I want to ask. I want to make sure that I convey it well and all these things. So then that just heightens up, right? So that just shows you where the nervous system goes because it goes into that like, uh, fight or flight. And that's where the symptoms seem to be triggered from. So if we can try to do things just to kind of let things calm down and do that breathing. Now, here's the good news, right? If you were net new, never had a concussion before, the average person takes 10 to 14 days for the symptoms to go away anyway, right? So you're on day 5. So I wouldn't start panicking that the symptoms are still present, right? You're still well within the window of normal. And what we also find from people in this program that have already done the work and already know the strategies, it does go a lot faster because you've already done a lot of the groundwork for it. You already have that kind of base, you already have that knowledge. So it's just now trying to kind of reassure yourself that this is going to be very temporary. This is not setting you back 2 years where you have to start all over again, right? It's just you just got to wait till things kind of normalize a little bit, do the foundational stuff. You might as well because all that stuff is going to be helpful. But if you can really internalize what we're saying, that this is a short-term thing, this is not going to be a long-term thing, I think that'll help to just kind of stabilize you where you can start to build back up again. And I think before you know it, you'll be like, oh shit, I feel pretty good.
yeah, got it. I love that. 14 days, I'll come in with questions like, let's see after the normal window, let's give my brain, give my body 14 days, like, let's give it that time, do the
Yeah.
basics, obviously.
Yeah.
But then when I have specific questions about, oh, waking up sucks, Dr. Hrkal, tell me what's going on hormonally. Like, what do I do? Like, that question actually is almost premature as well because I'm in that normal
Mm.
Yeah.
spaz out period,
Yeah,
14
you're in
days.
the
Like,
you're in the thick of it, right? Like concussion injury just happened. You're in that kind of metabolic low, right? Like we hit our peak metabolic low around day 5 to day 7, and then we start so like you're kind of in that sweet spot for where things tend to be kind of the worst. So just, give yourself that grace, take time, don't just lay around and do nothing though. Like you want to still kind of go about your day. You want to do walking and you want to do breathing. You want to do things to help yourself. But if you want to have a nap, have a nap, you know. If you need more sleep, try to get it. That's okay. That's fine. Perfectly fine.
Yeah, you're not gonna lose your progress. Yeah, I just wanted to say you're not gonna lose your progress, right? I think that's the biggest fear when there's a re-injury is, "Am I gonna lose all this progress I made to find my new normal and get back to my life following my first injury?" And no, you're not going to lose your progress. You already know what that looks like and what that feels like, and you'll get back there.
I appreciate that. Thank you so much for your time. I'll be in touch in the group.
And you mentioned sleep. And so, just I would even say, don't even worry about all those additional things because right now your nervous system is really what's amped up, and you're in that fight or flight. So in the acute stages, we want to implement some of the basic things. Like sleep hygiene is like a mindfulness type practice. So just focus on the things that Melinda and then Cam mentioned, and then after you get out of this acute kind of flare, then you can focus on, okay, I'm going to like really optimize my diet. So you're just really trying to focus on the basics to give your nervous system a chance to recover.
Thank you all so much.
You're welcome. All right, next up is
Hi. So I just have a question. Actually, this is my second time back in this group. I was very successful round one, but still dealing with a few things vertigo wise, like that are a little bit unexpected. And I've noticed like stress, of course, bringing it on. So I have two questions. One, when I've done some blood work, my ferritin level remains at like 6. And so I've been taking an iron supplement with vitamin C for that. And I'm just wondering if Dr. Hrkal has any thoughts on the iron patch for absorption versus the actual pill.
I have no experience with the patch actually, so I can't really comment on that. I use the pill, and I think this is more conventional. I mean, I don't know where the patch is really coming from. I would say if you really struggle with absorption from oral perspective, then you really want to look at an infusion of iron. And that's not a
Okay.
transfusion, just to be sure. That's blood, but we're talking
Yes.
about iron infusion.
Okay. We'll keep continuing. I mean, the pill just sometimes is a little bit upsetting on the stomach, so I had wondered if you had any experience with the patch there. So we'll kind
No,
of
sorry.
continue on with that. That's okay. And my second question around, I know a lot of my vertigo and stress are still around, or the vertigo is still around the stress of that. And so back at Melinda's modules again, and I'm just wondering if she has any thoughts on how to help. I find that I'm still very much guarded. Through that, I had this concussion in 2018, and I do massage and chiropractor every month. My chiropractor is great on working the muscles before adjustments, and my massage lady definitely earns every dollar of the hour I'm with her by getting into those muscles. But I do hold that tension in my neck and shoulders still, and I'm very guarded even when I'm sitting. And so I'm wondering if you have any suggestions on trying to. I do meditation. I try and relax, but even when I'm sitting at night, I very much hold my body um, in protection mode.
Well, the hardest part about that is becoming aware that that's what you're doing. So it sounds like you've got that covered, right? You've sort of developed an awareness that you do guard or hold your muscles tensely. Um, have you tried the progressive muscle relaxation practice in the program?
I have, but it's not. It's more like I use that at bedtime a lot.
Hmm.
So I find that I am very much grabbing at my pillow and still like crunched up with my neck. And so I'll use
Hmm.
that at bedtime to relax, but I have not used it during the day.
You can definitely use it during the day. It's sort of a more physical, sort of tangible way to remind your muscles that it's okay to relax. So, for those of you who don't know what that is or haven't got there, you can just tense your muscles gently, right? Of course, if we have an injury from concussion, we don't want to do this with force. It's just gently, say it's your hands, you're going to clench your hands for 5 seconds and then just allow them to soften. And I would, extend the invitation even further than what the meditation would say. And that's to when you soften and release the muscles, just see if you can let them go limp, right? That remind yourself that you're safe, right? Allow the muscles to just completely let go. So whether you need to do that lying down or supported in some way, that's just sort of this mental exercise of reminding your body that you're safe. And you can even validate for yourself that there's a reason your muscles go tense and you're in that holding pattern because there isn't a sense of safety that it's okay to let go. So like I said, the first step is being aware that that's happening. That's the hardest part. So you've got that. And then the second part is doing exercises like progressive muscle relaxation to help support and remind your muscles how to let go physically. Then once you've kind of done that for a little while, you can start to do it mentally, right? You can kind of, so there's this concept called neuro-linguistic programming, if you've heard of it, where we can actually repeat things to ourselves 3 times to support a release of muscle tension. So say you're in public and you don't have time to do progressive muscle relaxation, you can actually say to yourself, neck relax, neck relax, neck relax, or shoulders rest, shoulders rest, shoulders rest, and really picturing it as you're using those words. And it just sends a signal to the brain that I'm okay. I can actually allow those muscle areas to relax. And if you noticed a few minutes later that they're tightened up again, say it again. Okay.
Okay. Yeah, I do believe that. That's where my vertigo is kind of stuck, is that fear of it. And so it just hangs on. So I know that I need to work on that part of it.
Yeah. And I can almost hear Dr. Paul's thoughts right now about the vagus nerve and there's also a series of other exercises that you could do to help stimulate the vagus nerve, which can really support a down regulation of our nervous system. So I know Dr. Paul has talked about things like gargling or like in my section, I talk a lot about gentle movements. We did a few somatic lives in the program that you could refer to. All of those things stimulate the vagus nerve and support a down regulation of your nervous system. So what constant tension is telling us is that your body is in an upregulated or a highly activated nervous system state. So we're kind of in high alert. We want to help support you to down regulate that.
Yeah, I think I've been there for 5 years. So, unfortunately, I mean, I've learned a ton from this program the first time, which is why I came back. And I know that fight or flight is where I'm stuck. So,
Yeah.
I've been back on the magnesium again to try and help with that and in talk therapy. But yeah, that guarding is really holding on. And I know that's driving that neck symptom. So I'm trying to go back to yours before I get back to Dr. Cameron's section on the neck again. So
Absolutely. I think that's really important.
You're saying vertigo.
Mhm.
Are you getting any vestibular work? Has anyone ever looked at the
yeah, so I've actually been to a vestibular therapist, a couple of different ones throughout the past couple of years. Everything visually checks out. Everything. I've done the laser on the head with them. I've actually come back better at times when I've gone back due to a few spells that just kind of like set everything back off. And I do better at the head laser than when I left originally. So I've long worked through a lot of that, but I think what happens is I'm so fearful of this. Like sometimes the world just moves, and then I go straight into that panic. I immediately tingle and sweat and freak out, and then my mind, I go right to that catastrophizing. Like, here we go again. I'm never going to get out of this, and that's going kind of where I've always been stuck. So my neck muscles are always extremely tight, and everything really has checked out with that. So we've done everything from tossing balls and balancing and head movements and all of that vestibularly. And sometimes, I'm a little bit back. I think anybody probably in a normal state, they could find something wrong in vestibular therapy with, but I definitely have been put through the mill on a bunch of it. And I do feel like my neck is my issue because either the world moves or sometimes like through your modules, just even, I'll move my eyes at my computer screens and it'll set me off knowing, I mean, you can get into the suboccipitals. My chiropractor will dig in there before adjustments and they're very sore and they hurt. And I know it's just from probably guarding and the panic of it, but I've been through a lot of therapy.
Do you find that after treatment that dizziness sensation dissipates? Like, is the treatment helping that?
Yeah, definitely. Like
Okay.
when I miss massage, if I'm even about 2 weeks behind, I'll start to become symptomatic. So I definitely know. And if I've had a higher stress week with work or anything, if I have had even one little spell where I start to tense up again, um, it just gets worse. So yes, I do get much better with the
Have they
muscle work.
started implementing any type of neck strengthening with you yet?
They did at the beginning, and we did do a lot of that. But I've been out of that therapy for a while. So when I went back through and relogged into this program, I printed out all the stuff again on the T's and the Y's and getting back to that because I think re-listening to your stuff again was that where there's tension, there's weakness.
Right.
So I know that I sit in that cross. I'm at a desk all the time. And I'm hunched and I'm tensed so that even massaged this week. I asked her to kind of dig into the pecs, like was in your section, and they hurt, and it just hurts because I know I hold all that together. So I think I definitely need to get back to the strengthening. I have an appointment again on Tuesday with a therapist who's done a lot of your work locally here, I think in part of your programs. So I asked him if he would kind of look at where I need to focus on that strengthening again. So
Yeah,
hopefully
good.
he'll be able to pinpoint some of that.
Good. I mean, the fact that treatment makes it go away is good, but when it keeps coming back, it's usually a stability issue. And so now it's time to, in between appointments, be working on really strengthening that so you get more kind of
Okay.
longevity out of those treatments, right? So at a certain point, usually it's like manual therapy to start, but then once that's, working, then in between appointments, now it's time to start strengthening, um, so that it stops coming back all the time, right? Because that strength will produce better stability, which means less dizziness. So okay, sounds like you're on the right
Thank
track.
you. I
I like
appreciate it.
Okay. Next up.
Hi. Hey guys, how are you doing?
Good, how are you?
Good. So I had the concussion in 2016. One of the biggest hurdles to my recovery is very extreme childhood trauma that I had no recollection of. And it started popping up and coming up in kind of fragments. And the thing, and I've worked with EMDR, somatic experiencing, so like very severe therapies, very kind of serious therapies. But the the limiting factor is that the trauma doesn't come up on a schedule. It comes up when it comes up. And when it comes up, my nervous system just completely, like, it comes up with very extreme pain, and my nervous system just gives in. Where the first thing that happens is my digestion shuts down. So I'm not able to eat. I'm not able, even if I'm following a plan. I have a functional nutritionist. So he gives me, following a plan. I'm taking betaine with it, but it just like my body will not accept anything. I worked through the exercises medicine module. And in the beginning, I was having symptoms at like even like 120 beats per minute. So I've gone up to my maximum heart rate, and and I've cleared that. But I still feel that my nervous system is very, very weak in the sense that whenever those stressors come up, my digestion is the first thing that shuts down. And I've realized that my sympathetic nerves are just very strong probably because of the repeated and chronic trauma from childhood. So
Mhm.
I have two questions. What can I do? I also recently started doing parts work, Melinda, to try to get myself in a good space when that trauma is coming up. But so what can I do in the short term, and what can I do in the long term so that my digestion, my nervous system just gets stronger and I'm able to cope with the stress without the physical repercussions of it?
Great question. Thanks for asking and opening up to us about this. Um, well, first of all, just normalizing that digestion does shut down when we go into a sympathetic state. I think that's probably where Dr. Paul was going to go with that, because in a fight or flight response, we shut down certain functions in order to activate ourselves, to run, to flee, in order to get to safety. Of course, in modern day society, those are usually that. Um, Evolutionary response is not necessary, but it's still what happens in the body. So normalize that for yourself. It makes sense that digestion shuts down when you have a sympathetic response. But of course, wanting to work towards finding balance so that's not happening chronically to you. Now, you shared with us that the childhood trauma was long-standing and rather extreme, which just tells me that this will be a bit of a longer journey for you.
Yeah.
So I'm hearing that you've already done EMDR, you've done some trauma therapy, you're doing parts work, which is really, so parts work, for people who are on the call today that might not be familiar, there's a psychological theory called internal family systems, which looks at the self as a series of different personalities and parts that can sometimes be in conflict with one another. So when our self is trying to initiate a certain path in life, we can have certain parts that can prevent us from moving forward in those ways because they're working really hard to protect us from past traumas or from being hurt or anything else that might have happened to us in our lifetime. So working on the parts theory is a really great, I think, approach for you, given that you've tried some of the other trauma processing. So EMDR is trauma processing or reprocessing. That's supposed to help support and minimize those intrusive memories that can come up. The other piece is sort of working around whether or not you've had a diagnosis of post-traumatic stress disorder. That can help inform the types of trauma therapy that you can seek out.
Can you talk a little bit more about that, like the benefit of getting a diagnosis? Like, I know I have complex PTSD because I have very severe trauma from like birth to age 8, and this was like life threatening and it was chronic. So I know, like, I didn't know this, and like, so what's the benefit of getting a diagnosis, and like, how would you?
Yeah. Sometimes there's certain things in the assessments that can point you more directly to what types of therapy are going to be most helpful for the type of trauma that you sustained as a child. And it's very individual. So, I'm hearing you're sort of just doing some of the trauma therapy, but it could be helpful to get that assessment done to understand, well, what specifically are the recommendations for the type of trauma therapy I should be seeking
And
out.
who's the best practitioner to get that assessment from?
What
Like,
yeah,
is
where
it
where are
is
you
it a?
located?
I'm in Wilmington, Delaware,
Okay.
the state of Delaware. Like,
So do they have there's clinical psychologists there?
yeah.
Yeah. So I would
Okay.
say clinical psychologist um, would be the best person to seek out a psychological assessment for PTSD or complex PTSD. You can just say PTSD because they'll determine whether or not they need to
Okay.
rule out complex PTSD. That would be my recommendation. If you're not sure where to look for that, psychologytoday.com is a resource that we share that's really helpful to search for a qualified mental health professional to support you. So you can look up assessment, psychological assessment for PTSD using that website and filter for your geographical area, and that will come up. So I would focus on that first before looking at how to slow down the nervous system response. However, in parallel to the work you're doing, it would be great to just include the light grounding and stabilization work that we explore in the program. So things like walking, mindful walking, so feeling your feet against the ground, including the sounds and senses around you. So naming what you can hear, what you can see, what you can smell, depending on, of course, making sure that those might not be, that they are not triggers for some of your trauma. I'm not sure what those triggers are. Sometimes senses can be triggering for PTSD. So, really just making sure to speak with a health professional around how you can navigate some of the grounding and stabilization techniques that we offer here so that they aren't triggering, because that could also be a possibility of what's happening. Maybe you're working on some nervous system regulating techniques that could be activating a trauma response.
I think I've kind of worked past that. I'm pretty good
Okay,
about identifying triggers. Like, there were certain spices that used to really trigger me, so I would
got you.
like really steer away from them. And
Yeah.
I've kind of worked through that.
Mhm.
But I think for me, just, realistically speaking, in terms of getting back, having a career, earning money again, the nervous system is the thing that keeps me kind of stuck, because anytime, first of all, I have no control over when the memory is going to come back. So when it comes back, the first thing that happens is I find that I'm very sensitive to light. So I'm turning my
Mhm.
screen brightness all the way down. I'm turning, I'm pulling in blackout curtains. And
Yeah.
that's the first thing, is because, and, I'm sometimes like, I even have one of those flickers now. So I'll turn the Wi-Fi off, and that will help me regulate a little bit. But
Mhm.
realistically, that's not something I can do and keep a job, because I can
Mhm.
control the environment in my own home, but I have to be able to reintegrate into society. And it's been a really
Mhm.
long time. And I think this is, like you said, I think this trauma, it didn't happen overnight. It wasn't just a one and done thing. So it's going to be kind of like a long haul thing. So I would love to kind of know how to be able to manage it and still have a life.
Absolutely. And I think, you've got a really great start with some of the work you're doing. So potentially a psychological assessment to identify, specifically what types of trauma therapy would be helpful, might be a way to go. And the other piece is that you're here, I would imagine, because you had a concussion. So your trauma history is one of your predisposing factors. So I'm not sure if your, onset of flashbacks or images or intrusive thoughts have come back more since your concussion, but that could be
Yes,
quite
yes,
common. Yeah.
yes, yeah. That's
Mhm.
when it started.
Yes, right. So the history of the trauma was a predisposing factor to developing more long-term or long-standing kind of challenges following concussion. So this is something we really understand now, that can make sort of that concussion recovery more difficult. So for you, you've got sort of different layers of the onion to peel, but I think you're well on your way. The way you're communicating it to me sounds like you've got a lot of awareness and a lot of knowledge about how to support that, and I would keep going on that trajectory.
Thank you. Thank you.
All right, now we're going to go to.
This is a question for Dr. Hrkal. I went through the list that was in the module for basically like all the baseline things that you should get tested. And my question is about getting tested for magnesium. I know that he said that the blood levels were not really like an accurate representation of testing for magnesium, and it was recommended more like a hair tissue analysis. So when I asked and magnesium is one of the things that my body just really, really devours, like 700 to 900 milligrams of neuromag I take a day, sometimes even more. So I know that it's a huge something about magnesium is a very big player for me. So I really would like to know, why or what. So anyway, my naturopathic doctor said that it has to be paired with trace minerals and toxic metals in order to be read properly. And like you can't just test for magnesium. What does that mean? And is that accurate? Like that it's all kind of bundled together, basically.
Right. Okay. So you're asking about magnesium testing. So let's talk about that right off the bat. So what your naturopath is talking about is something called the hair mineral analysis. And this is a way of testing some of the levels of minerals that we have in our hair, which do reflect to some degree or another the levels that we have in our tissues or our bodies. And so the test includes all these other minerals. You can't just do a magnesium hair mineral analysis. You have to also get it with everything else. It's a very inexpensive test, so it's not like you're going to be paying an incredible amount of money.
This was like $600 or something.
No, that's not the one that I think they're talking about. That's not the hair mineral analysis that I use here in Ontario. It's usually about $100, $150 for.
Which one is that? Like, what's the name of that?
There's a company called CanAlt Labs, and I believe there's a number of other ones. I forget which other companies, but that's the one that I use, and that's here locally in the Toronto area.
And that's something that can be mailed out because this was going to be like $300 to $500 or so dollars.
Yeah, I know. And there might be, to be fair, there might be speaking about another test. There is another test called a SpectraCell test, and that is a blood test for trace minerals that they look at.
No, it was hair. It was hair.
Yeah. So then I think that's much higher than the one that I usually use. But again, always, whenever you see something like that, just ask the ND. Like I have lots of my patients, I encourage them to be curious about and advocate for their own health. And sometimes they're like, oh, you know what? I can't afford that. All right. So what's option B? Well, we can actually test for, we can test for RBC magnesium, which is a blood test, which RBC versus serum. So serum is just what's floating around your blood. RBC is red blood cells. So it takes a little bit longer, a couple of days longer. It's a little bit more expensive. Again, we're talking the difference of tens of dollars, not crazy amounts, but they will look at magnesium inside your cell. Now, that is probably the best case that we have. There is a couple other kind of like in the research lab tests for magnesium that are a little bit more accurate, but the RBC magnesium gives you some sort of idea. But remember, the last thing I'll say here is that magnesium and other electrolytes, they're very tightly controlled in the bloodstream because they regulate all your cellular function, right? We talked about in a concussion, you get your head impact happening, and then you get calcium rushing into the cell. And what's inside the cell? Well, your potassium and magnesium. And so there's an imbalance of sodium and calcium that's inside, and then the body tries to work so hard to pump it out, and that's where it loses all of its energy within the first couple hours after. That's why the mitochondria are so derailed. And so if you have adequate levels of magnesium, then that exchange is easier because they play off each other. So the body tightly regulates this. So I think hair is an imperfect test. And I think that regular serum blood is imperfect, but RBC magnesium may give you an idea. And so that's the testing piece. Hopefully that answers your question.
Okay, so you'd recommend that I go back and ask for the RBC?
I think that's a good place to start.
Okay. And then the two of the other ones that, because I just basically went through the module and then made a list, of all these basic things. You're like, oh, get all this stuff tested.
Sure.
It was I think the NA, let's see. Yeah, the NAC and like the B6 panel. They were just saying like, oh, we can't find anything like that. And it's going to be, again, like around $600 to get those labs drawn. Like they couldn't find a lab order to pull for a B6 panel and an NAC. It's run through like a larger nutrient panel and it's around 600.
Yeah, okay, so NAC, that's true, that you can't really check for cysteine levels. That's going to be a more comprehensive amino acid panel. But vitamin B6, you can test in blood. I don't in the course, maybe it was something that you kind of misremembered, but I don't talk about testing for NAC specifically.
So then that was just my bad. Okay, so and then just get the B6, yes, tested.
That's through blood, and yeah, usually that is paid for. So it's something around $50 to $100 for that test in blood.
Okay, great.
At standard labs.
Okay, so I don't need the NAC, and then the RBC is a blood test, right?
RBC magnesium is a blood test. Yeah.
Okay. And then my other question is about medication. So, or getting off of medication rather. I'm just curious if you know historically in any of your patients, if you have seen them. I mentioned a while back that I was put on Klonopin shortly after my concussion, like a very small kid's dose, 0.25, because I had an anxiety attack and they didn't even know I'd had a concussion. They didn't know why. They were just trying to kind of calm my body down. Okay. But I'm still on that. Like, have you seen people put on that and also get off?
You're talking about Klonopin specifically, the medication?
Yes.
Yes, absolutely. You can get off.
And are there things? Have you had patients like? Are there things that you do to assist with that taper so that your body doesn't freak out?
It's hard to predict the type of withdrawal symptoms a person might have, but usually the longer that you've been on it, the harder it is to get off because of just some of the neurotransmitter receptor habituation that happens. And so I think that if you've only been on it for a short period of time, I think that's a good thing. This is
it's been about a year.
Okay, well, yeah, that's a substantial enough amount of time to have some of that kind of habituation happening. Some people get off it really easily. You do want to have a good taper. There are definite kind of supportive nutrient protocols that you can put into place. You're probably doing a whole bunch of them already with the right electrolytes, minerals, because those are all cofactors for your neurotransmitters. Getting some of this blood testing done that you're talking about, like the B6, is a really important cofactor for making a lot of the key neurotransmitters like dopamine, GABA, for example, are dependent on B6. And so getting those tested, optimizing those levels, and then kind of putting in a nutrient supported protocol along with the weaning protocol of the Klonopin is something that can be very helpful. And I would definitely speak to your naturopath about how to do that strategically.
Okay, so there's no specific nutrients that you would recommend for withdrawal support?
No, you know what? I don't think it's fair for me to say that right now because it's so individualized. I would say that that's definitely a conversation for Andy. But I will tell you that I think that there is something that could be done to help you ease that process. Again, some people have really easy time and some people have a really hard time, but most people have kind of some symptoms that are transient that last for a couple of weeks. But a slow taper makes a difference.
Okay, and like, what does that mean? Like, because they're compounding it, so they said, oh, we can just compound, 10%
Yeah.
less, whatever percent less. Like, what does slow mean? Like 10%, 25%? Like,
Your each medication is a little bit different. So that's a question for your prescriber. So whoever prescribed it is the one that should help you with the titration down. Some of them again depends on the patient, depends on the medication. Some of them can be a kind of a quicker taper. Some of them can be longer. I don't, off the top of my head, I can't give you the exact ideal taper for Klonopin.
all right, great, thank you.
You're welcome. Great questions.
Great. We can switch over to the comment questions. So there are a few comments, a few questions that were put in the comments. So the first one is, as a parent to a toddler and another baby on the way, how can I still implement the recovery mindset section when I'm running on almost empty already? And the sleep hygiene section when I'm in constant sleep deprived state and it won't be ending for a few years, as new baby will also require support throughout the night.
Great question. And it's a really hard chapter if you've sustained something like a concussion to then be also in this postpartum journey. I think that the best invitation is to be gentle with yourself and allow yourself to slow down in life in the ways that you can, right? Sleep deprivation is going to be part of your picture for a while. I say to people though, if they find that, post concussion, there's a lot of significant challenges, seeing if it's within your means or within the capacity that you have to get some extra help with that. So I know Dr. Paul will probably have something to say about the importance of sleep, but seeing whether or not there's a possibility to help you get that sleep if you're finding that's a huge impairment to your concussion recovery. I know dozens of clients who needed that following injury or illness in the postpartum period, where it was like, you know what, the recommendation to them was that they needed at least 5 hours at a time. So what can you do to support yourself to get that? And what does that look like? Maybe it's adjusting what your breastfeeding journey you had pictured it to be. That's always a big one for moms. Maybe there's a way to do some pumping and some bottle feeding, having somebody help with getting up in the middle of the night so that you can get that 5 hours that is often recommended at one time for REM sleep. I bet you Dr. Paul will know that a bit more specifically than I do. Other than that, it might be this sort of gentle process of reevaluating all the things you have to do in a day during that time in your life when you're postpartum and healing from concussion. So really simplifying, being kind and gentle to yourself for everything you're going through, and seeing, if you can kind of go on the kiddos' schedules, rest when they rest when they're napping. I know it can be so tempting to want to do all the things around the house or do what you can or take some time to yourself when the kiddos are napping, but sort of shifting that mindset to, can I rest when they rest, can be really supportive, not only for concussion recovery, but to getting through that postpartum period. Those are kind of the two things coming to my mind right now. Dr. Paul, I'm not sure if you had any more sort of evidence-based information around how much sleep is needed to sort of support concussion recovery.
I think in terms of a minimum, I'm going to say that it's my experience that it's really different for everybody. So some people can thrive off 5 hours of sleep. Some people don't thrive at all. I always say that, that is something that each individually people have to figure out if that's what's going to work for them. And then, this is a really fascinating conversation around, a time of your life that you really need extra support, and also someone's so intimately dependent on you to support them. So I think that, I think, Melinda, your suggestions are brilliant. I think that that's a really helpful way of kind of figuring out, is there support that people can give you, really minimizing the extra things, like, there's some fascinating cultural evidence actually, where people in Asian communities for the first month, they're just like really almost nesting, and they're not out. Like I remember with our second child, My wife felt so amazing. It was such an easy delivery that it was something that she was able to go to the mall within a couple of days. And honestly, that is not recommended. And so, I mean, I think this is an added stressor for you. And in my opinion, find ways to really declutter anything else. And that's probably, probably a good place to start. There's really no other kind of way to get around that this baby's requirement. How old is the baby? Can you remind
There's
me?
one on the way and a toddler.
Oh, okay. So how old's the toddler? 2?
Probably.
It didn't specify, just said toddler.
Okay, toddler. It's tough because now you have all these hormones of pregnancy that are being thrown around in there. Lynn, I know you're shaking your head because you've been through this before. We all have. We're all parents.
Yeah.
The one fun thing from a naturopathic perspective, I really will emphasize is that this is a time that you really want to kind of support your body's adrenal system. And so things like bone broths, things like adrenal formulations, this is a great time for a naturopath to kind of if they're not on board already, to give you some support that is safe during pregnancy, is safe during lactation, and you're going to be able to kind of like really get nourished. Like that is going to, if you need a meal service for a while, then do that. The sleep is a challenge, and it's a bit of a catch-22 because I'm such a big fan of breastfeeding. And so trying to unload that to do like formula, maybe in extreme situations is necessary if you really need that sleep. I think pumping is a good idea, but just note, you really underestimate the nutrition that moms need during this time. So it's like everything you can do to get like smoothies, like over and above your meals, smoothies and electrolytes and minerals and bone broths and soups and stews is all going to be really, really helpful. We feel for you because we've all been there without a concussion, so we know how hard that can be.
Yeah, absolutely. And the only other thing that was coming to mind is just reevaluating expectations. So, especially as a mother, like there might be certain expectations you have on yourself of how you should parent. But if you have a concussion as well, it may not be the best to be pushing yourself to meet those expectations. Now, of course, we don't know what those are, but every parent, especially mothers, have expectations on how they want to show up for their kids. So sometimes it's okay to reevaluate those, particularly when you're trying to recover from a concussion. So whether that's like we mentioned with breastfeeding, because sometimes, a great example of an expectation is to exclusively breastfeed, but that may not work during a concussion recovery. So there may be other ways to do that. Like we already mentioned, pumping, having someone bottle feed to give you that extra rest, that extra break. Now, that's just an example that comes to mind, but there's lots of other ways we can look at reducing those expectations or shifting expectations during a concussion period. Those could also be things like, what are your expectations to be a good mom? And do you have to cook everything from scratch? And is there a way to support yourself to, buy some already cut up vegetables that you can just throw into a pot and cook a stew? Or can you do more crock pots? Or maybe you need to ask for help and get someone to make you food and bring you food. These are all things that can help sort of modify the workload following, especially if you're preparing to bring in a new baby to the world. And that's going to be, come with its whole host of other demands.
Totally, yeah. Great suggestions, Melinda.
Or support from grandparents potentially, or maybe you have a spouse that can take a parental leave as well. Like that would be super, super helpful to offload. Yeah.
Postpartum doulas as well. They are a big thing, and research has shown that those help a lot too with new parents, is having that person there.
Yeah, sometimes that toddler is an X factor. It's like, they're so full on that they're the ones that are exhausting you. So if you're like, okay, like, can we get some support here that obviously fits with your values, and obviously your resources, whether it's a doula, whether it's a nanny, whether it's family support, whether it's daycare part-time, for half a day. Like we've done all this in ourselves, our own family personally, and we still are very like much focused on like connection and relationship and attachment parenting. So
yeah, getting creative, not being afraid to get creative with some different ways to do things for now.
Okay.
Awesome. All right, next question. I hit my head hard on the edge of a kitchen cupboard door yesterday when I went bent down to pick something up off the floor. I felt dizzy, somewhat headachy after it happened, and was even more fatigued than usual last night. Today, I'm still feeling all these symptoms in my vision that had taken months to clear after my last concussion 8 months ago is back to being blurry again. I also have a stiff neck and more head pressure. The head pressure had never really cleared after the last concussion. The concussion I had 8 months ago was one of the many, and aside from a moderate TBI I had years ago, which involved a skull fracture and an epidural hematoma, has been the slowest to recover. I have watched the video on concussion cliffs, but I'm still not sure how to tell which is a concussion cliff and which is a concussion.
My question back is, what does it matter? It doesn't matter either way. Was it another concussion? I don't know. Was it a concussion cliff? I don't know. Doesn't matter because the treatment is the same. So if you had another concussion, what are you going to do? You're going to double down on diet. You're going to try to calm the nervous system. You're going to try and get, some light exercise. You're going to try and, take it easy for a couple days. You're going to try and prioritize sleep, right? It's the same exact thing if it was a cliff or if it was a concussion. So people often get hung up on the idea of like, oh no, was this another concussion? The answer really doesn't matter because the treatment and the process is the exact same whether it was or it wasn't. You just want to support yourself in this period, similar to what we were talking about with our, I don't know if it was somebody early on that was having the same issue. So yeah, don't worry about if it was or it wasn't, just do the things you got to do.
Great. And another one here. So I did get a very long write-up, so I've kind of condensed it and then just have the question at the end. They have complex PTSD, and a lot of nervous system dysregulation is the biggest challenge. They are doing grounding skills and integrating it with the Concussion Fix program already. They realize that inward focus, such as breath work, is too overwhelming, and so they've shifted the focus to external sensory input. They've discovered that smelling a cherry-scented eraser had a strong calming effect on them, and so since then they've started to experiment with different scents. They use scent. They were in a waiting room where there's a very strong scent of coffee, though, that was a trigger factor for them. Was not helpful. But they found sitting in front of a scented candle reduced fatigue. So they've been exploring different sensory aspects. Had a weighted blanket, which found that really helped them a lot. So now the question is, do you have other ideas on how they can incorporate touch, taste, and particular smell in trying to balance out their nervous system? Any advice on what I need to focus on or experiment with further after all my newfound discoveries about myself?
Yeah, well, it's great to hear that this person has been able to sort of experiment with different ways of helping to support a calming effect, and that, they're willing to sort of try different things to figure that out. So that's always a big part, is being willing to sort of experiment a little bit. So that's great. What I'm hearing is the process of what's happening is when you're present with a scent or was it a sound? What was the other one? There was sense, and then there was an
The
example
weighted
of
blanket really helps.
oh,
So
the
scent
weighted
and weighted
blanket. Thank
blanket.
you. So when there's a scent or a feeling, it's bringing a sense of safety to the body. Usually the weighted blanket is that sends a signal to the brain that you can calm down, right? It activates our parasympathetic system. How it works with scents is that usually we become very present to the scent. And that enables sort of, in essence, letting our guard down a little bit so that we're not in that high alert sympathetic state. So this is how mindfulness works, right? We're engaging we're putting all of our attention to one aspect of our experience, and then everything else kind of fades away in the background because we can't focus intently on one aspect of our experience and also simultaneously be thinking and doing 5 other things, right? So this focused attention, this building a skill of focused attention, is sort of the point of some of these sensory exercises in mindfulness. So I'm hearing that this individual is able to identify senses they like, senses that aren't working, which is great. I would say, finding different ways to engage that system. So if the weighted blanket worked, perhaps something like mindful walking would work. So finding your feet against the ground, feeling the pressure of your feet against the ground as you're walking, that can send a very grounding feeling in the body and promote that parasympathetic nervous system activation. Similarly, we recently did a somatics live in which we did seated practices that were able to engage, pressure on our hands, pressure against the wall, pressure against with our feet against the ground in a lunge position. So if a weighted blanket works, I'm curious whether other things like that would also be very helpful for you. So that may be something to review, is the somatics live that we did recently. As far as the scents, doing more of the ones that are calming and just taking the rest into consideration. Okay, so that was activating for me, right? You obviously have a heightened sense of, what is resonating and what doesn't resonate, or what might sort of activate your nervous system versus calm your nervous system. And that's all things just to sort of take into account so that you know. And the point might be to build a toolbox of these skills, whether that's in grounding or mindfulness or other, that support you when you need them. So you might be doing the, quote unquote research, creating hypotheses and then testing them to see what skills and techniques and tools can I put in my toolbox so that I have them available to me when I need them. And the other point you mentioned is that you'd like to do them consistently, I think, or that there's an interest in sort of doing a lot of these nervous system regulation pieces, I believe. And that's great. So once you've got your toolbox full, implementing them consistently, even when you don't need them, can really help build that foundation for regulating nervous system dysfunction. I think that's all I really have to go on for that question.
Dr. Hrkal, did you have anything you wanted to add?
Well, no, I think Melinda covered it, honestly. There's really nothing, I don't really know too much about scent, so yeah.
Great. And I know I'm talking to the member also about olfactory system and all that, because it's very powerful, our olfactory system.
Yeah, you might have some training in that with the aromatherapy and things that you have experiences with. So encouraging that as well.
Mm-hmm.
See you later, everyone. Have a great day.
Thanks for joining us. See ya.
Thanks, guys. Bye. Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.